So, hello everyone. Today we are going to discuss another set of question for PhD entrance. So, as you can see, questions over here. First question is, when we want to establish a relationship between the concept, which is most appropriate method? When we want to establish relationship between the concept, which of the method is most appropriate? Just think about the answer of this question. We'll come back to this question later on and we'll discuss the answer for this question. Our next question is, spread of dispersion is described by. Your option for this question is median, mode, standard deviation, mean. Okay, so moving on to the next question. Yeah. A nurse is caring for a 9-year-old child who underwent tonsillectomy. Which of the following observation by the nurse is most concerned? Okay, con- tonsillectomy. A child had tonsillectomy. Then, which of the following observation is going to be most concerned for a nursing personnel? The first option is 30 ml dark brown secretion. Option B is a heart rate of 90 beats per minute. Option C is expectorating bright red secretion. Your fourth option is infrequent swallowing. Okay, moving on to the next question. The principle of beneficence include all the following except सारे included है but इनमें से एक जो included नहीं है. Your options for this are freedom from harm, freedom from exploitation, benefit from research, and the fourth one is right to self determination. Okay, so moving on to the next question. Yeah, the next question is, the following are the method used to collect objective data except. ये सारे जो है मेथड है ऑब्जेक्टिव डाटा कलेक्ट करने के एक्सेप्ट वन. एक कौन सा है जो नहीं है? योर ऑप्शन फॉर दिस इज इंटरव्यू, the next option questionnaire, records, and Likert scale. Okay, next question, which scale of measurement has an absolute zero? Your option, the first one nominal, ordinal, interval, and ratio. Next question, which of the following is not used frequently in health education? Means which of the method is not used frequently in health education? So your option for this are textbook, poster, film strip, audio cassettes. Okay, so think about the answer of all those questions which we discussed previously, and we'll get back to the each question. Get back to each question, previous discussed question, and we'll see the answer afterwards. Okay, so the next question is, which design involves the collection of data at one point of time, right? Here your keyword is collection of data at one point of time. Your option for this is case control design, longitudinal design, cross sectional design, and cohort design. Next question is, the leadership style in which the leader alone determines policies and make plans. It's called as क्या कहते हैं उसे? The first option is democratic, autocratic. Next option, third is rewarded, and the fourth is laissez-faire. Okay. Next question is, authority means. What do you mean by the authority basically in this question? ये पूछा जा रहा है. Your option for this are right to command, right to reprimand, right to use and abuse power, right to perform duty. Okay, next question, which teaching method is based on one way communication? Option for this are lecture, conferences, workshop. Okay. And the last one is none. Okay, the next question, the basic principle of health education are, क्या है basic principle of health education? Your option for this are the interest of people, participation, reinforcement, and the fourth option is all. The next question, in experimental research, the aim is to assess the effect of which variable? Your dependent variable, independent variable, extraneous variable, confounding variables. Extraneous variables or confounding variables. Okay. The next question is, who has given the 14 principle of management? Daniel Freud, Mary Follett, Henry Fayol, and Florence Nightingale. The last question is, a client is admitted to hospital with a bowel obstruction. Which of the following is the priority of nursing diagnosis? Okay. Your option for this is fluid volume deficit, deficient knowledge, ineffective tissue perfusion, pain related to the abdominal distension. So just see the question here. A client is admitted to the hospital with a bowel obstruction. Bowel obstruction के साथ admitted है. Which of the following is the priority nursing diagnosis? Your option for this is फ्लूइड वॉल्यूम डेफिसिट, बाद में देखेंगे हम. डेफिशिएंट नॉलेज, ये भी बाद में देखेंगे. वी आर गोइंग टू सी दिस वेदर है नहीं है, हम नॉलेज देंगे, हेल्थ एजुकेशन देंगे, बट आफ्टरवर्ड्स. इनइफेक्टिव टिश्यू परफ्यूजन, अगेन द तो इंटेंस चीज़ है जो सबसे ज़्यादा उसे परेशान करेगी पेशेंट को, दैट इज़ पेन रिलेटेड टू द एब्डोमिनल डिस्टेंसर. सो आर प्रायोरिटी नर्सिंग डायग्नोसिस विल बी your pain related to the abdominal distension. So this is the right answer for this particular question. Okay. So, moving on to the next question. Yeah, moving on to the to next question. Your next question is, who has given the 14 principle of management? Henry Fayol. This question is from your management part. Henry Fayol given the 14 principle of management. Okay, this is a very straight question. No need for the further discussion. Okay, the next question. In experimental research, the aim is to assess the effect of which variable? किस वेरिएबल के इफेक्ट को हम एसेस करते हैं? डिपेंडेंट वेरिएबल और दोज वेरिएबल जिस पे हमें देखना होता है. इन एक्सपेरिमेंटल रिसर्च द एम इज टू एसेस द इफेक्ट ऑफ विच वेरिएबल? डिपेंडेंट वेरिएबल और दोज वेरिएबल जिन पे हम इफेक्ट देखते हैं, राइट, जिस पे हम इफेक्ट करते हैं. इट मीन्स इनडायरेक्टली यू कैन से दैट मैनिपुलेशन ऑफ विच वेरिएबल इज टेकन प्लेस. किस वेरिएबल का आप मैनिपुलेशन करते हो, किस वेरिएबल का मैनिपुलेशन करते हो, जिसका मैनिपुलेशन करते हो उसी के इफेक्ट को आप देखते हो. सो द राइट आंसर फॉर दिस क्वेश्चन इज योर इंडिपेंडेंट वेरिएबल. ओके, सो मूविंग ऑन टू द नेक्स्ट क्वेश्चन. या द basic principle of health education are, basic principle of health education, हेल्थ एजुकेशन का बेसिक प्रिंसिपल क्या है? इंटरेस्ट. जब हम व्हेन वी आर डिलीवरिंग हेल्थ एजुकेशन, व्हाट द एम एंड बेसिक थिंग वी आर हैविंग इन आवर माइंड, वी नीड टू सी द इंटरेस्ट ऑफ द पीपल. लोगों का इंटरेस्ट क्या है, क्या वो जानना चाहते हैं. बिकॉज अगर इंटरेस्ट नहीं होगा देन पीपल विल नॉट गैदर, पीपल विल नॉट लिसन टू यू and your talks. So we need to take care of the interest of the people. Then participation, whether there will be participation among the people and people with people to the healthcare provider, health talk provider, उनके साथ कितना participation है, that also we need to see. And the reinforcement, it means the all three things are the basic principle of health education. So the right answer for this question is all. Okay, next question. Which teaching method is based on one way communication? It's very easy question. Conference में one way communication है, it's depend on conferences is like I think नहीं, I am sure that जो भी इस वीडियो को देख रहे होंगे, इफ़ दे दैट पर्सन इज़ फ्रॉम द फील्ड ऑफ नर्सिंग, तो वो तो कॉन्फ्रेंसेस, वर्कशॉप, ये सारे कुछ अटेंड कर चुके होंगे, तो दे माइट नो ऑल दिस थिंग। कॉन्फ्रेंसेस हमें एक से ज़्यादा लोग होते हैं, और कम्युनिकेशन का भी वन से अधिक रास्ते होते हैं, वेज होते हैं, वर्कशॉप आल्सो। तो वन वे कम्युनिकेशन पे क्या आपका टीचिंग मेथड बेस्ड है, दैट इज़ ओनली द लेक्चर, बट यहाँ पर लेक्चर कम डिस्कशन आता, देन देयर विल बी द टू वे कम्युनिकेशन, बट हियर द ऑप्शन इज लेक्चर ओनली, so the right answer for this question is lecture. Okay, the next question is authority means, the right answer for this question is authority means right to what? Right to command. Right. This is the right answer for this question. Okay, moving on to the next question. The leadership style in which the leader alone determine the policy and make the plan. Democratic सभी की चाहिए हमें. Rewarded is not a not a any kind of leadership style. This is spirit जिसमें कि सब anyone can give suggestion. So the right answer for this question is autocratic. Okay, moving on to the next question. Which design involves a collection of data at one point of time? One point of time. The right answer for this question is your cross-sectional design. Why? Why not case control, longitudinal and cohort? Just go and see the definition of all these three. You will get to know why it is not. Okay. Moving on to the next question. Which of the following is not used frequently in health education? क्या यूज़ नहीं होता है हेल्थ एजुकेशन में फ्रिक्वेंटली? योर पोस्टर, यू आर गोइंग टू यूज़ पोस्टर, आप लोग बहुत ही ज़्यादा यूज़ करते हो पोस्टर, एंड फिल्म स्ट्रिप आल्सो यूज, ऑडियो कैसेट आल्सो यूज्ड इन केस ऑफ health education process, but textbook you are not using. So the right answer for this question is your textbook. Okay, which scale of measurement has an absolute zero? Ratio scale is having both the things, having all the three things में क्या होता है? Absolute zero होता है आपका. One of the property is absolute zero also. So the right answer for this question is your ratio. The following are the method used to collect objective data except. इनमें से कौन से methods है सारे के सारे जो कि ऑब्जेक्टिव डाटा को कलेक्ट करने के लिए यूज किए जाते हैं, बट एक नहीं किया जाता? ऑब्जेक्टिव डाटा मीन्स, व्हाट इज ऑब्जेक्टिव डाटा? विच इज डिप्राइव ऑफ सब्जेक्टिव कंटेंट. इट मीन्स जो क्वेश्चन पूछा गया है, द person is very much like giving answer to that question, that particular question only, and there are no content of subjective method. खुद से खुद की ओपिनियन, खुद की बातें उसमें शेयर नहीं की जाती. दैट इज द ऑब्जेक्टिव डाटा. एक पर्टिकुलर क्वेश्चन का आंसर एक ही तरीके से कोई देगा. इफ द मेथड इज दैट इज द असेसमेंट ऑफ द ऑब्जेक्टिव डाटा. सो कौन सा है? क्वेश्चनर. एक क्वेश्चन आप लिखोगे, उसके 2-4 ऑप्शन होंगे. इट मीन्स जो क्वेश्चन लिखा गया है, एंड यू नीड टू गिव द आंसर among those options only. So this is the method, one of the method of collection of your objective data. Records also like that. Likert scale also. Interview. In case of interview, you are able to add your subjective content or your opinion depending upon the question. So the right answer for this question is your interview. What was your question? The following are the method used to collect objective data except. कौन सा नहीं है objective data के assessment का method? So the right answer for this question is your interview. Okay, moving on to the next question. The principle of beneficence includes all the following except. सभी included है, कौन नहीं है? Freedom from harm included है, freedom from exploitation is included, benefit from the research is included. The right answer for this question is the right to self determination is not included. Okay, to the Next question: a nurse is caring for a 9-year-old child who underwent tonsillectomy. Which of the following observation by the nurse is most concerned? The first option, 30 ml dark brown. Dark brown, it means that can be the collected blood. No need to concern that much or priority concern नहीं है. Heart rate, it's okay type. After surgery, 90 beats per minute is not a big deal. Infrequent swelling, that could be there. Tonsillectomy हुई है तो इस ये priority कुछ नहीं है, मतलब इतनी, this is not the priority observation और प्रायोरिटी कंसर्न. व्हाट द थिंग जो कि सबसे ज़्यादा प्रायोरिटी कंसर्न का, ब्राइट रेड मीन्स ब्राइट रेड सिक्रीशन. एक्सपेक्टेटिंग ब्राइट रेड सिक्रीशन मीन्स देयर कुड बी द चांसेस ऑफ हैविंग fresh blood. So the right answer for this question is expectorating bright red secretion. Next question is spread of dispersion is described by spread of dispersion. Dispersion itself suggests what? Spread of dispersion, that is the measurement of dispersion. Dispersion, it's not central tendency. Dispersion, it means diversion. Diversion में क्या आता है आपका, इसका mean, medium, mode, all three are the measures of central tendency. Odd one out is your standard deviation. It means the spread of dispersion is described by the standard deviation is the right answer for this question. Okay, now come to the first question. When we want to establish a relationship between the concept, which is most appropriate method? दो concept के बीच एक relationship establish करना है. Multiple choice can do like that? No. Short answer, no. दो concept के बीच एक relationship establish करना है, right? Suppose like 14 principle of management given by 14 principle of management. One side it's written 14 principle of management, another side written the name of so and so person. It means you are and you need to establish the relationship between this concept and the concept of the other hand. So with the multiple choice you can do like that? No. Short answer you can do? No. Alternate option responses you can do like that? No. So what the right answer for this question is matching. Matching the right answer for this question. So this was all about your PhD question answer session, question answers discussion session. So next class will see some other thing where either maybe PhD question or the basic of research. Properly will deal with the research portion. So thank you for now. Keep learning.